So now we're going to start the gluteal region. See, gluteal region is a very important topic for the INACT exam. From 2016 up to 2023, in the AIMS exam, INACT exams, we are getting one question for sure. Every year, 2 times in the AIMS and INACT exam, we are getting one question from this topic. Very simple topic. Now the questions will be mainly from the gluteus muscle only. They are asking the nerve supply and the actions. Right. So now to begin with, we're going to start the gluteus maximus muscle. So now first muscle is our gluteus maximus muscle. So this is our gluteus maximus muscle. Now what is the origin of gluteus maximus muscle? Again, no need to know the exact origin of gluteus maximus muscle. See the diagram and get the basic idea. That is more than sufficient. Origin they won't ask you. Okay. So now origin from, now this is the ilium bone. This is sacrum bone. This is coccyx. So gluteus maximus take origin from these three bones. Okay. So origin of gluteus maximus, ilium, sacrum, coccyx, and we have one ligament below that, that is our sacrotuberous ligament. This is the origin point for the gluteus maximus muscle. Insertion you have to know. Okay. Now insertion of gluteus maximus muscle. Now 3/4 of the muscle attached to this point. What is that? That is the iliotibial tract. Iliotibial tract, and 1/4 of the muscle attached to gluteal tuberosity. Okay. So insertion, 3/4 of the gluteus maximus muscle attached to the iliotibial tract, and 1/4 of the muscle attached to this point. Can you see the tuberosity here? This one. This is the gluteal tuberosity attached to gluteal tuberosity. Okay. Right. Now in this diagram, yes, we are seeing the lateral view of the thigh. In the lateral view of the thigh, we see iliotibial tract. Now iliotibial tract is the modification of the deep fascia of thigh on the lateral side. It is the modification of the deep fascia of thigh in the lateral aspect. Okay. Right. Now two muscles attached to the iliotibial tract. One muscle in the front side, that is our tensor fascia latae muscle, and in the back side, gluteus maximus muscle. So two muscles attached to the iliotibial tract, tensor fascia latae muscle and gluteus maximus muscle. Okay. Right. Now gluteus maximus nerve supply, inferior gluteal nerve. Inferior gluteal nerve, it is the branch of sacral plexus, and it supplies only one muscle, gluteus maximus. Okay. And see the diagram. Now this is the posterior view of the femur. Now in the posterior view of the femur, we see the gluteal tuberosity. Okay. So gluteal tuberosity, again, please mark. They gave this question 2 times back to back in the AIMS and INACT exam. The question is, they marked the gluteal tuberosity, and the question is the action of muscle attached to the marked area. That is a question we got. Okay. So now what is the action of gluteus maximus muscle? So gluteus maximus muscle, it is crossing the hip joint on the back side. So what I do? Hip extension. So action of gluteus maximus muscle, number 1, hip extension. Now what is the next action? See, gluteus maximus muscle, 3/4 of the muscle attached to iliotibial tract. Iliotibial tract is a modification of deep fascia on the lateral aspect of the thigh. So this muscle also do lateral rotation of the hip. And please remember, it is the prime muscle or main muscle for lateral rotation of the hip. Prime muscle or principal muscle for the lateral rotation of the hip. And the muscles doing the lateral rotation, they also do abduction. Abduction of the hip. Now this is a line given by the Gray's anatomy. Now this muscle extending the thigh. Okay. And this muscle is a prime muscle. I told you the prime muscle or main muscle for lateral rotation of the thigh. And the upper fibers, they are also helping for abduction. So please remember, the gluteus maximus muscle is having 3 actions. What are those? At the level of hip joint, hip extension, lateral rotation, and abduction. And this is the question they gave 3 times in the AIMS and INACT exam. What is the action of the muscle attached to the marked area? Extension, abduction, and lateral rotation. Clear? Right. So we completed gluteus maximus muscle. We know the origin, we know the insertion, we know the nerve supply and action. Everything is over. Now we're going to cut the gluteus maximus muscle, and next we're going to see gluteus medius and minimus muscle. Now gluteus medius and minimus muscle, they take origin from only one bone, ilium bone. Okay. Now what about the insertion? Now both the muscles attached to greater trochanter of the femur. Attached to greater trochanter of the femur. Now this is the diagram. Now this is the upper part of the femur. This is the head of the femur. It is the neck of the femur, and this is the greater trochanter of femur, and this is the lesser trochanter of the femur. Lesser trochanter of the femur. Okay. Now the gluteus minimus muscle attached to the anterior surface of greater trochanter. What about gluteus medius muscle? Gluteus medius muscle attached to the lateral surface of greater trochanter, the oblique ridge on the lateral surface of greater trochanter. This is gluteus medius muscle. See, insertion point you have to know. So anterior surface of greater trochanter, gluteus minimus muscle. In the lateral surface, gluteus medius muscle. Okay. Right. Now, what is the nerve supply? Now, gluteus medius and minimus muscle, they are supplied by superior gluteal nerve. Please remember, superior gluteal nerve, it supplies how many muscle? 3 plus 1. What are those? 3 plus 1 means our gluteus medius muscle, gluteus minimus muscle, tensor fascia latae muscle, and please remember piriformis muscle. See, piriformis muscle, please write plus or minus option. In the recent Gray's Anatomy, in one page, they have given superior gluteal nerve supplying piriformis muscle. Now, while describing the muscle piriformis, they gave the piriformis is supplied by the fibers from S1, S2. So, piriformis, they have given 2 nerve supply in the recent Gray's Anatomy. In one page, they are saying superior gluteal nerve. The another page, they are saying S1, S2 fiber. So that is why we are writing piriformis as a plus or minus option for the muscle supplied by superior gluteal nerve. And they gave this question 2023 May INACT. They gave this question, and they were asking only 3 muscles. So gluteus medius, minimus, and tensor fasciae latae muscle. Now the same question they will give 1/4 time for sure, and definitely they will expect you to know the superior gluteal nerve also supplies piriformis muscle. Please write piriformis plus or minus option. It is the muscle supplied by superior gluteal nerve. So 3 plus 1. Okay. Next one. What is the action of the gluteus medius and minimus muscle? Now, I told you if you want to know any action, yes, origin point is fixed one. Insertion point, move towards the origin point. So now the greater trochanter, which will move towards the origin point like this. Move towards ilium bone like this. So femur is moving away from the body to meet the origin point. So femur, it is moving away from the body to meet the origin point. So what is the action of gluteus medius and minimus muscle? Number 1, they move away from the body to meet the origin point. So action is very good. Abduction of the hip abduction. Okay. And we have anterior fibers. Now the anterior fibers, they rotate the femur internally, medial rotation of the hip. So gluteus medius and minimus muscle, they have 2 actions at the level of hip joint. Number 1, abduction of hip, and number 2, some anterior fibers, they rotate the femur inside, internal rotation, medial rotation. Okay, so these 2 are the actions of gluteus medius and minimus. Shall we proceed? We know the origin, we know the insertion, we know the nerve supply, we know the action. Now gluteus medius and minimus muscle, when they act from below, they also help in stabilizing the pelvis. Now see the diagram. We'll draw a line diagram. Now this is the pelvis. Now both legs are supported to the ground. Now we assume this is right side, this is left side. So both leg, yes, the right side, left side, they are supported to the ground. This is the first diagram. Now second diagram. Now the patient is lifting the left leg. So left leg is in air and the right leg is supported to the ground. Okay. Now see the diagram. So left leg is in air, it is not supported to the ground. Now what the gravity will do? The gravity try to sink the pelvis on the left side because that is not supported to the ground. So gravity try to sink the pelvis. Gravity try to sink the pelvis on the left side, on the unsupported side. But pelvis is not sinking on the left side, unsupported side. Why, sir? Because we have muscle. What muscle, sir? We have gluteus medius and minimus muscle. Okay. So gluteus medius and minimus muscle on the supported side. On the supported side or right side, what they do? They prevent the sinking of pelvis on the unsupported side. Prevent the sinking of pelvis on the unsupported side. On the unsupported side. Okay, right. So gluteus medius and minimus muscle prevent the sinking of pelvis on the unsupported side. Clear? Right. So now third diagram. Now again the patient is lifting the left leg. So left leg is in air and the right leg is supported to the ground. Right leg is supported to the ground. Now the problem is, now the patient is having, I told you, gluteus medius and minimus muscle. Now gluteus medius and minimus muscle on the right side, it is not working. The muscles are paralyzed. Why, sir? Because superior gluteal nerve injury. Now what will happen? Now I told you the gravity always have a tendency to pull the structures down. Now the gravity sink the pelvis on the left side. Now in this patient, the pelvis sink on the left side or unsupported side. Why, sir? In the right side, in the supported side, the muscles are not working. Why, sir? Which nerve injury? Superior gluteal nerve injury. So now in the case of superior gluteal nerve injury, please don't write, listen, I'll give the notes. Listen. Now in the case of superior gluteal nerve injury, the gluteus medius and minimus muscle not working. So pelvis sink on which side? On the unsupported side, left side. When the patient is standing on right side is not a normal side. Right side is the paralyzed side. Now this is called Trendelenburg sign. So now please write Trendelenburg sign. What is Trendelenburg sign? Trendelenburg sign is nothing but it is the pelvis sink on the unsupported side. The pelvis sink on the unsupported side. Yes, pelvis is sinking on the left side. This is unsupported side. Now when the pelvis sinking on the unsupported side, when the patient is standing on the right side normal side, no. Right side is the paralyzed side. When the patient standing on paralyzed side. Patient is standing on paralyzed side. Now this sign is called what sign? Trendelenburg sign. Trendelenburg sign is due to involvement of which nerve? Nerve, I'm asking. Nerve. Yes, very good. Your superior gluteal nerve. Due to involvement of which muscles? Gluteus, medius, and minimus muscle. In the old exams, they give some history and they give Trendelenburg sign positive. This is due to involvement of which nerve? Superior gluteal nerve. Muscles, gluteus medius and minimus muscle. These were the questions we got in the old exams. The recent exams means in 2 to 3 years I'm saying, they're asking these type of questions. The FMGE and also INACT, we got this question. This type of questions only. They gave clue in the question itself. The patient is having waddling gait. Trendelenburg sign is positive. They gave all those clues in the diagram, in the question itself. And they added the word. The question they gave, the pelvis is sinking on the right side. This is due to involvement of which nerve? The similar question was asked in the FMG exam too. They gave an INSET and also the FMG exam. Similar question. So Trendelenburg sign positive and the pelvis is sinking on the right side. It is due to involvement of which nerve? Option A, left superior gluteal nerve. Option B, right superior gluteal nerve. Option C, left inferior gluteal nerve. Option D, right inferior gluteal nerve. So they gave clue in the question itself. The patient is having Trendelenburg sign positive and we know the nerve involved. The nerve involved is, yes, our superior gluteal nerve. Okay. Now the pelvis is sinking on right side means, now right side is the unsupported side. So pelvis is sinking on right side means the right side is the unsupported side. Now when the pelvis will sink on the unsupported side? When the patient is standing on paralyzed side. So left side is the paralyzed side. Okay. So left side paralyzed side means which nerve is involved? Left side superior gluteal nerve. It is the affected nerve. So what is the answer for this question? Yes. Left side superior gluteal nerve. The patient is standing on the left side. Patient is standing on the paralyzed side and the pelvis will sink on the unsupported side, right side. So pelvis is sinking on right side means that is due to involvement of which nerve? Left side superior gluteal nerve. This is a question we got in the recent exams. The recent exams, we are getting question like this. Okay? Right. Shall we proceed? Now that's all about the gluteus medius and the minimus muscle. Okay? Right. Now next, now we're going to remove the gluteus medius, minimus muscle and the maximus muscle. Now we have some small muscles which are present under the cover of gluteus maximus muscle. So please write muscles under the cover of gluteus maximus muscle. If you remove the gluteus maximus muscle, then we see these small muscles. What are the muscles? Number 1, small muscles, piriformis muscle. Number 2, gemini superior muscle, obturator internus muscle, gemini inferior muscle, and quadratus femoris muscle. Now these muscles are present under the cover of the gluteus maximus muscle. Now see the diagram. Now in this diagram, yes, we are seeing the posterior aspect of the upper part of the femur bone. Now I told you the greater trochanter, on the lateral surface, the gluteus medius muscle is attached. Now we have trochanteric fossa. Now in the trochanteric fossa, one muscle is attached. What muscle? Our obturator externus muscle attached to the trochanteric fossa. The fossa on the middle side of the greater trochanter. Okay. Now on the upper part of the trochanteric fossa, we have tricipital tendon attachment. Tricipital tendon is formed by superior gemini, inferior gemini, and in between the obturator internus muscle. So these three muscles are called, they form tricipital tendon attached on the upper surface of trochanteric fossa. Upper surface of trochanteric fossa, these three muscles attached. The greater trochanter is having the inward projections. The inward projection is due to attachment of which muscle? Piriformis muscle. So piriformis muscle attached to the inward projection of greater trochanter. Okay. And last one, your quadratus femoris attached to quadrate tubercle. A separate tubercle for this muscle. Quadrate tubercle. Now these are small muscles present under the cover of gluteal region and their attachment to femur. Okay. Now what are the actions of these small muscles? Now actions of these small muscles. Now these small muscles, they help the gluteus maximus. They help the gluteus maximus muscle in lateral rotation of the femur. Now these muscles are not a main muscles, they are helping muscles for gluteus maximus in the lateral rotation. I told you, gluteus maximus, it is a prime muscle or main muscle or principal muscle for the lateral rotation of the femur. So these muscles, they help the gluteus maximus for this movement, lateral rotation of the femur. Okay. Right. Now only one thing is pending about these muscles. Now what is the nerve supply? I told you piriformis, it is supplied by S1, S2 fiber and also by superior gluteal nerve. Okay. Now nerve to obturator internus. Nerve to obturator internus supplies superior gemini and obturator internus muscle. Okay. And the nerve to quadratus femoris muscle supplies the inferior gemini and quadratus femoris muscle. Try to know the nerve supply. This is enough, more than enough. And actions. Now that's all about the muscles in the gluteal region. Now out of all these muscles, which muscle is called key muscle in the gluteal region? Now piriformis, it is called the key muscle in the gluteal region. Piriformis is the key muscle in the gluteal region. Why, sir? Because the neurovascular structures in the gluteal region, they emerge either above the piriformis or below the piriformis. Okay. Now, what are the structures which are passing above the piriformis? Above the piriformis, we have superior gluteal nerve and a superior gluteal artery. Now, below the piriformis, what are structures? Inferior gluteal nerve and inferior gluteal vessels. And then sciatic nerve. And then posterior femoral cutaneous nerve. And then pin structures. Your pudendal nerve, nerve to obturator internus, and internal pudendal artery. So these structures, they are passing below the piriformis. Again, all these structures, they are passing through greater sciatic foramen. So greater sciatic foramen, which transmit piriformis muscle, only one muscle passes through the greater sciatic foramen. So please write structures passing through greater sciatic foramen. So please write structures passing through greater sciatic foramen. What are those? Number 1, piriformis muscle. Number 2, superior gluteal nerve and superior gluteal vessels. Number 3, inferior gluteal nerve and inferior gluteal vessels. Number 4, sciatic nerve. Number 5, posterior femoral cutaneous nerve. Number 6, your nerve to obturator internus muscle. Number 7, internal pudendal artery. Internal pudendal artery. And number 8, pudendal nerve. Now these are structures passes through your greater sciatic foramen. Now see the pudendal nerve. See, pudendal nerve is resting in ischial spine, one bony landmark, ischial spine. So if you want to give the pudendal nerve block, now what is the bony landmark we are using? Ischial spine. So ischial spine, it is the bony landmark to give the pudendal nerve block, for the pudendal nerve block. Okay, because pudendal nerve is resting on the ischial spine. I told you already in the perineum topic, we're discussing about the pudendal nerve. So pudendal nerve passes through greater sciatic foramen and it is entering the gluteal region, and in the gluteal region, it is resting on ischial spine. The course of pudendal nerve, it is explained already in perineum topic, pudendal nerve. Okay. So pudendal nerve in the gluteal region, it is resting on the ischial spine. So ischial spine, it is an important landmark for giving pudendal nerve block. Pudendal nerve, it is a nerve of perineum. Now pudendal nerve should enter the perineum. How it enters the perineum? By passing through another foramen. What is it? Lesser sciatic foramen. What are structures passing lesser sciatic foramen? Again, last 3 structures, these pin structures. So this is our lesser sciatic foramen. So I'm putting a box. So that is our lesser sciatic foramen. Lesser sciatic foramen. So what are structures passing lesser sciatic foramen? Please write structures which are passing through lesser sciatic foramen. What are those? Pin structures. Your pudendal nerve. Number 2, internal pudendal artery and nerve to obturator internus. And last structure, tendon of obturator internus. Tendon of obturator internus muscle. Not the muscle, only tendon will pass through. If they give obturator internus muscle, means that is wrong. muscle is not passing through lesser foramen. The tendon of abductor internus is passing through lesser foramen. So lesser foramen transmit pin structures, prudental nerve, interprudental artery, and the nerve to abductor internus and the tendon of abductor internus. These are structures passing through lesser foramen. Okay, that's all about the gluteal region. So very simple topic. So in this topic, yes, we discussed gluteus maximus muscle, medius muscle, minimus muscle, and we know the action of these three muscles. And we also discussed the small muscles under the cover of gluteal region, and we know the nerve supply of these muscles. And we also discussed about the structures passing through lesser and the greater sciatic foramen. Okay, that's all about the gluteal region. Now we're going to start the gluteal region. Now in the gluteal region, the first muscle, bulk muscle, that is our gluteus maximus muscle. Now the gluteus maximus muscle inserted to iliotibial tract and also to the gluteal tuberosity. That is iliotibial tract you are seeing there, right? Now what is the action of our gluteus maximus muscle? Gluteus maximus muscle mainly do two actions. See there, the hip joint is moving on the back side. That is the hip extension, number one. Number two, the gluteus maximus muscle is helping for, it is a main muscle for lateral rotation of the hip. Yes, we're going to see the action. See there, the hip joint, the femur bone turning on the lateral side. See there, turning on the lateral side. That is the main action. Gluteus maximus is a main muscle for the lateral rotation of the thigh. Principal muscle for lateral rotation is our gluteus maximus muscle. Now we are seeing gluteus medius muscle. And if you remove the medius muscle, then you can see the minimus muscle. See the action? Now the hip joint is turning on the medial side. See, medial side is turning. And there's also another movement. The hip is moving away from the body. It is called abduction. So gluteus medius and minimus muscle, they will do two actions. Number one, yes, medial rotation, and number two, abduction. Now, we are seeing the piriformis muscle. Now, the piriformis muscle is coming via that foramen. That is our greater sciatic foramen. See there? There's a greater sciatic foramen and the piriformis is coming. Now, piriformis is a key muscle, and below that, you are seeing the superior gemelli muscle, and then that is the tendon of abductor internus, and that is the inferior gemelli muscle, and below that, this is the quadratus femoris muscle. Piriformis, yes, superior gemelli, tendon of abductor internus, inferior gemelli, and this is the quadratus femoris muscle. These are small muscles below the, under the cover of gluteus maximus. Now what these muscles will do? Same action. They help the gluteus maximus in turning the hip joint laterally, lateral rotation of the hip joint. These small muscles, they help the gluteus maximus in lateral rotation of the hip joint. Okay, right. So now we're going to see the nerves here. Now piriformis, that is the key muscle in the gluteal region. You can identify the neurovascular structures, yes, by the help of our piriformis only. Now see here, you are seeing one thick nerve, sciatic nerve, and then our posterior femoral cutaneous nerve, and then prudental nerve you are seeing. Right. So now we're going to see the gluteal nerves. Now that is a piriformis muscle. Just below that, the inferior gluteal nerve will come, and the inferior gluteal nerve supplies only one muscle, our gluteus maximus muscle. Okay, yeah, that is our inferior gluteal nerve that will supply only one muscle, our gluteus maximus muscle. Now next we're going to see the superior gluteal nerve. For that we have to remove the gluteus medius muscle. Yes, and that is our superior gluteal nerve. So superior gluteal nerve will supply three muscles: gluteus medius, minimus, and tensor fasciae latae muscle. Now these are the neurovascular structures in the gluteal region. Now we're going to start the hamstring muscles. So hamstring muscles, these are the muscles in the posterior part of the thigh, posterior compartment of the thigh. Hamstring muscles we have. Now the hamstring muscles, they have a common properties. If we say hamstring muscle, the hamstring muscle, they should take origin from ischial tuberosity. Okay, and all the hamstring muscles should insert to bones of leg. Bones of leg means either tibia or fibula. Now, what is action? Hamstring muscles cross the hip behind and they cross the knee behind. So, muscle cross the hip behind. What they do? Hip extension. Muscle crossing the knee behind. What they do? Knee flexion. So, hamstring muscles, they cross the hip behind and the knee behind. So, extend the hip and flex the knee. Now, what is the nerve supply? All the hamstring muscles should be supplied by the tibial component of sciatic nerve. Tibial component of the sciatic nerve. Okay, right. These are the properties of the hamstring muscles. Now, see the diagram. Now, in this diagram, we are seeing the ischial tuberosity. So, ischial tuberosity, that is the origin point for the hamstring muscles. Now, ischial tuberosity, it is divided into upper quadrilateral and lower triangular part. Upper quadrilateral part and lower triangular part. Okay. Now, in the upper quadrilateral part, now we have oblique ridge, and the oblique ridge divide the upper quadrilateral into upper lateral and this is lower medial. So, please write. In the upper quadrilateral part, we have oblique ridge, and that oblique ridge divide the quadrilateral part into two triangular part. Okay. So, upper lateral part, which gives origin to semi-membranosus muscle. So, semi-membranosus muscle takes origin from the upper lateral part. Okay. And the lower medial part, which gives origin to semitendinosus muscle and biceps femoris muscle, long head. Biceps femoris muscle, only long head we take origin from the lower medial part. Okay. Now come to the lower triangular part. Now the lower triangular part, see, this is the lower triangular part. Now in the lower triangular part, again we divide into lateral and medial. Now the lateral part of the lower triangular part, which gives origin to hamstring part of adductor magnus muscle. Hamstring part of adductor magnus muscle. And in the medial part of the lower triangular section, which is not giving any origin to hamstring muscles, no muscle takes origin. No muscle origin from this part, which is giving attachment to only one ligament. What ligament? Sacrotuberous ligament. Okay, right. Now again, in the exams, they won't ask this much detail. Now, if you remember, if you can identify the ischial tuberosity in the diagram, that is more than sufficient. They won't ask this much tough question. For the completion's sake, we are seeing this. Now, if you remember, the ischial tuberosity, it is the origin point for the hamstring muscles. That is more than enough. If you identify ischial tuberosity in the diagram, that is more than enough. This is ischial tuberosity. Okay, right. Now, next one. Now, what are the hamstring muscles we have? Number one, semitendinosus muscle, hamstring muscle. Semitendinosus muscle, again, name actually you have a clue. Part of the muscle is fleshy and part of the muscle is tendon, semitendon. And we know already, semitendinosus muscle attached to the medial surface of tibia, along with gracilis muscle and sartorius muscle. I told you, these three muscles are gyrops muscle. What are those? Sartorius, gracilis, and semitendinosus muscle. Now, these three muscles on the tibia attachment, which is giving the appearance of the goose leg, duck's leg. So, these three muscles also form what group? Pes anserinus pattern. Yes, already we seen this. Now, next muscle is semi-membranosus muscle. Again, in the name itself, you have a clue. Semi-membranosus. Part of the muscle is fleshy and part of the muscle is membrane, semi-membranosus muscle. Now, semi-membranosus muscle, after the insertion to tibia, is giving some extensions. Now, one of the extension you have to remember is our oblique popliteal ligament. So, oblique popliteal ligament is nothing but it is a extension of, which is the extension of semi-membranosus muscle insertion. Okay? Yes. Now, this oblique popliteal ligament is pierced by, we have some opening, and that opening is due to the some structures piercing this ligament. So, structures piercing the oblique popliteal ligament. Oblique popliteal ligament. What are those? the posterior division of obturator nerve plus middle genicular vessels. Middle genicular artery. Middle genicular artery, it is a branch of popliteal artery. And the posterior division of obturator nerve, do you remember this? I told you, the posterior division of obturator nerve passes through one opening, adductor hiatus, and then come to the popliteal fossa. In the popliteal fossa, I told you it supplies popliteal artery and the knee joint. How it supplies the knee joint? By piercing this ligament. So posterior division of obturator nerve pierces this ligament and supplies the knee joint. Okay, so structures facing oblique popliteal ligament, two structures, posterior division of obturator nerve and the middle genicular artery. Middle genicular artery is a branch of popliteal artery. Okay, right. Now, next muscle, biceps femoris muscle. Again, the name itself you have a clue. Biceps femoris muscle is having two heads. The long head of biceps femoris muscle and short head of biceps femoris muscle. Long head of biceps femoris muscle, it is a hamstring muscle. Short head is not a hamstring muscle. Why, sir? Now see the diagram. The long head is taking origin from the ischial tuberosity. Whereas a short head, it is not taking origin from ischial tuberosity. I told you just now. If you say hamstring muscle, they should take origin from ischial tuberosity. The short head of biceps femoris, it is not taking origin from ischial tuberosity. It is taking origin from the femur bone. So short head of biceps femoris, it is not the hamstring muscle. Okay, right. Now, again, the biceps femoris muscle, yes, the long head, short head, they join together and then they inserted to the head of fibula bone. Now, we have one more muscle in the hamstring rope, that is our adductor magnus muscle. Now, adductor magnus muscle also not a true hamstring muscle. Why? Because insertion. I told you, if you say hamstring muscle, yes, they should attach to bones of leg. But adductor magnus muscle, it is not attaching to bones of leg. It is attaching to adductor tubercle. It is attaching to adductor tubercle of the femur. It is not attaching to bones of leg, not attaching to tibia or fibula. The muscle attaching to adductor tubercle on the femur. That is why we are not saying adductor magnus as a true hamstring muscle. Now, the adductor magnus muscle, previously, it is attaching to tibia bone only. Because of evolution, the muscle went more proximally, leaving one ligament in the line of attachment. What is that? That is our medial collateral ligament. And this is our adductor tubercle. So this is our adductor magnus muscle attaching to adductor tubercle. Now, exactly the same line of attachment with this ligament. What ligament? Medial collateral ligament. So, what is medial collateral ligament? Medial collateral ligament is nothing but the primitive insertion of adductor magnus muscle. Primitive insertion of adductor magnus muscle. Adductor magnus muscle initially attaching to tibia only. 1000 years back, 1500 years back, the muscle attaching to tibia only. Because of evolution, muscle went more proximally, leaving one ligament in the line of attachment. What ligament? Our medial collateral ligament. So, medial collateral ligament is nothing but the primitive insertion of adductor magnus muscle. Okay, right. So, these are the hamstring muscles. Now, what are true hamstrings? So, true hamstring means we have only true hamstring means we have only three muscles: semitendinosus muscle, semitendinosus muscle, semimembranosus muscle, semimembranosus muscle, and long head of biceps femoris muscle. Biceps femoris muscle. Okay, right. These three muscles are true hamstring muscles. Why short head is not a true hamstring? Because origin from femur. What about adductor magnus muscle? Adductor magnus muscle also not a true hamstring because attached to adductor tubercle of the femur bone. Okay, right. Now, what about the nerve supply? I told you all the hamstring muscles, they are supplied by the tibial component of sciatic nerve. The tibial part of sciatic nerve. Except the one muscle. Which muscle? The short head of biceps femoris. Short head of biceps femoris, it is not supplied by the tibial part of sciatic nerve. The short head of biceps femoris is supplied by the common peroneal part of sciatic nerve, which is supplied by the common peroneal part of sciatic nerve. Okay. So please remember the shoulder biceps femoris. It is not supplied by tibial part of sciatic nerve. That's all about the hamstring muscles. So hamstring muscles, very small topic. So we have some basic properties, and if you know the muscles, that is more than sufficient. Okay, that's all about the hamstring muscles.